So which of the following medications is used to reduce inflammation? A, epinephrine, B, lidocaine, C, heparin, D, dexamethasone. What does each one of these do? Epinephrine, if it's added to the local, prolongs the effect and reduces bleeding by using the vasoconstriction, which means it constricts and makes the vessels smaller. Epinephrine can also be used in an emergency for anaphylactic shock, cardiac arrest, or severe asthma. It can be topically applied to bleeding surfaces to control the bleeding. You see this a lot in ENT where they'll soak a neuropathy in epinephrine and it will vasoconstrict and reduce bleeding. In high doses or in the wrong locations, severe extremities, because you risk ischemia, which is you're vasoconstricting it so tight to the place that needs blood flow to get the oxygen to those places. So ischemia is a lack of oxygen from the lack of blood flow. You don't want to vasoconstrict your digits like your fingers and your toes, and you don't want to do it in your nose and your penis. Lidocaine is a local, quick acting. It typically takes 2 to 5 minutes to take effect, but doesn't last as long as, say, Marcaine. AINE is a typical suffix for local, so we know that doesn't reduce inflammation. It can be an antiarrhythmic used for ventricular arrhythmias. It's often just a local, also used for like nerve blocks, spinal, epidural anesthesia. This is your anesthetic, so not reducing inflammation. So your heparin is an anticoagulant, which means it prevents clotting. It's used to prevent DVTs, which is deep vein thrombosis, or PE, which is pulmonary embolism, or an MI, which is myocardial infarction, all having to do with clotting issues. A deep vein thrombosis is a deep vein clot. Pulmonary embolism, clotting in your lungs. Myocardial infarction is myo is muscle, cardio is heart, and infarction is tissue death due to the lack of blood supply. You're going to use them a lot in surgery in your ports, in your portacath, your dialysis catheter. You're going to put it in there to prevent the actual port from clotting up. You're going to do something called heparin lock, which kind of flushes it in the IV or catheter line and keeps it from clotting and preventing the flow of whatever it is you're trying to put through the port. Dexamethasone, it's a corticosteroid. You can use it for reducing post-op nausea and vomiting, but also used to reduce inflammation because it's a steroid. It manages an allergic reaction. It can be part of chemo protocols, treat cerebral edema in trauma or tumor cases. It's a powerful anti-inflammatory. It can increase your blood pressure and has a long half-life of 36 to 72 hours. We must taper it if used long-term to avoid adrenal suppression. The answer to what reduces inflammation, D. One quick way that you could figure this out, dexamethasone ends in sone, S-O-N-E. That's a common suffix for a steroid, which is an anti-inflammatory. If it ends in sone or it ends in alone, it's a steroid zone. So sone and alone is a steroid zone, and that can help you realize it's a steroid and that it reduces inflammation.